I chose labor and delivery for a reason. I think it's so fun to work with moms, dads, and babies during one of the most vulnerable and exciting times in your life. You're so impressionable, and I love being a nurse that can be there and support you and help you have the best experience possible. Now, whether you come with a desire to have an unmedicated experience or to get an epidural, I want to help provide you with the best experience I can. And in a hospital setting, we feel like we can help you accomplish the goal of having a healthy mom and a healthy baby in the end, while also helping you to have the kind of experience that you desire. If you desire an unmedicated experience, then yes, we're going to do everything we can to support you. One of our largest roles is to help you and your support person know different things that you can do to cope with the pain. We can't be in your room 24/7, but we can train those that have been brought with you as support people to help you. And when it gets closer to the end, when labor is progressing quickly and it's close to the delivery time, then we will be with you the entire time to support you and help you through it. If you're planning on an unmedicated delivery, I suggest taking some sort of class that's going to help prepare you, because if you go into the experience without being prepared, you're going to be blown away, and it's going to be a lot harder than you probably thought. So beforehand, you need to learn how to breathe. You need to learn how to teach yourself to relax on command. There's lots of different things you can look into. There's Lamaze and hypnobirthing. There's just basic breathing and relaxation techniques. But what it all boils down to is basically proper breathing and different modes of distraction. So that mode of distraction can be as simple as, one time I had a patient tape a Twix bar to her bathroom door that was in front of her, and she just looked at that every time she had a contraction because she wanted to eat it when she was done. Or people who try Lamaze go into guided imagery, and they literally close their eyes and take themselves to a different place. Sights, smells, taste, touch, and sound, so that you're not in that moment at that time in your mind contracting and hurting. Hypnobirthing consists of a whole bunch of scripts. So it's usually like a videotape or an audio tape talking to you about the different things that are happening in your body. You're imagining what's going on while you're contracting, and that helps you through. There's basic breathing and relaxation techniques like music, massage, position change. There's all sorts of things that we can teach you to help you have the kind of experience you'd like. When it comes time to actually go to labor and delivery and have your baby, though, your nurse and doctor will talk to you more specifically about how all of these different things can be applied to you. For example, let me tell you about a patient I had a few weeks ago. She desired to have an unmedicated delivery, and she was doing really well when it came to pain control, but her baby wasn't tolerating labor as well when she was in certain positions that were comfortable to her. So she wanted to stand, and sometimes that's just fine. But every time she stood up, her baby had a big dip in the heart rate. And after, 3 times of doing that, we all knew that it wasn't just a fluke thing. The baby did not like that position because the umbilical cord was being pinched somewhere. And actually the position where the baby gets the most blood and oxygen and nutrients is when you're laying on your side. And so she had to labor on her side so that her baby could tolerate labor. So your baby actually dictates everything that happens while you're in labor, and it's good to go into the whole process keeping an open mind, because things don't always go as planned either. C-sections are necessary some of the time, and obviously that throws someone's plans to have an unmedicated delivery out the window. But C-sections are only done when they're necessary for you or your baby. And thankfully we live in a day and age when C-sections can be done safely. And it does come with risks, bleeding and infection being the highest risks, the biggest risks. Also, it can affect future pregnancies, but we can also do them safely and get a healthy mom and a healthy baby out of the process. And so, again, talk to your doctor and nurses when you're going through the experience. And if you have questions about epidurals or other forms of pain control, because it gets to the point where you don't feel like you can tolerate natural labor anymore, then that's okay. We would love to support you and help you and do whatever we can to help you have a good experience. Now, as for the benefits to having a natural birth, I racked my brain and I can't actually think of very many medical benefits. But if you talk to anyone who's had a natural childbirth experience, they may tell you that you just feel this rush of endorphins and you feel this high afterwards. And a lot of people get a lot of gratification out of that. Mostly, I think it boils down to the emotional and mental gratification that people get from having done it. And I kind of call it the She-Ra effect, because you were able to do it, you endured it all, and you have bragging rights after that. I had an unmedicated delivery and didn't have an epidural. Now, some people worry about labor length when it comes to epidurals, if epidurals are going to affect how long your labor is. And a lot of studies have been done on this topic. And I think it kind of depends on the author and what viewpoint they may be trying to share with the world. But just from practice, I've seen that epidurals can do both. They can speed labor up in certain instances, and they can also slow it down if it's not not given at the right time. So, for example, one time I had a patient who was 7 centimeters for 4 hours, and it was her first baby, and she'd already been in labor for like 25 hours, and she was totally exhausted. And she finally got an epidural. And let me just add in there that up to this point, she was out of control. She wasn't breathing effectively. She wasn't using position changes properly. She was actually just like flitting around the room and yelling and kicking and screaming and totally out of control. So her body was working so hard on dealing with the pain that it wasn't able to focus and do what needed to be done. Dilate and have a baby. So after she got an epidural, only 20 minutes later, she was 10 centimeters fully dilated because her body was like, thank you, now I can actually do my job. So there are times when epidurals can actually speed things up. Now, if we were to give you an epidural from the second you walked in the door, not contracting because you just didn't want to feel any pain at all, we would have a hard time getting you going. And so usually we just recommend that when you get an epidural that you're at least contracting every few minutes and that you're hurting bad enough to want pain medication for what you're feeling. But, that's really only the possible benefit I can think of from medical benefit to having an epidural, is that perhaps your labor could go slightly faster. But again, we talked about how an epidural can help it go faster as well. And pushing time, generally speaking, may be a little bit longer with an epidural because you don't have that urge to push in all cases. So I also then, there's the flip side to everything. I've seen women with epidurals push for 20 minutes on their first baby when normal pushing time is 1 to 2 hours. And I've seen women who don't have an epidural push for 2 hours. And so it's basically, it boils down to your circumstances. And when you're in the moment, your doctors and nurses, like I said earlier, are going to do everything they can to help support you. And, I hope the best for you. If you have any more questions about your specific situation, be sure to talk to your doctor. But if there's any other questions I can answer for you, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.